So good afternoon, everybody. Not afternoon, almost 4 ही बज चुके हैं. Like good evening. बस 4 बज के 1 या 2 मिनट हुए हैं probably. And let me just set up again the things so that उसके बाद में we can start. Since couple of days, actually, a lot of things are going. So as such, there is actually mood तो रहता है, but you know that like some things are always there and you have to just like deal with them. Yesterday, almost like around 8 or 8:15, we tried to have some topics on the prosthodontics, and we will be covering next topics. Just एक पॉइंट तक हम आ चुके थे. Okay, it will look good right now. So let me just like stop everything else so that we can start. So what things we have to cover right now?
Could you clarify what specific things you're referring to?
No.
That way, I can give you more targeted advice or feedback.
No, actually, I was just like about to start a YouTube live session, and you are also live. So together we can host a ChatGPT Neat MDS live podcast, YouTube live session. And I was just thinking about discussing or reading few of the topics from the prosthodontics.
That sounds like an exciting idea. A live podcast or YouTube session featuring both ChatGPT and your expertise could attract a lot of interest, especially if you combine your knowledge with engaging content like tips for NIMDS exams, dentistry, or related discussions. If you have a clear structure in mind, like topics, questions, or an outline, it could make the session more impactful. Plus, promoting it ahead of time would likely help bring in a good audience. What topics or focus would you want to dive into during the live session?
Let's start about, let's say, what is a ferrule effect?
Great. What specific topic or theme would you like to start with for the live session?
No, just
maybe something related to NIT MDS preparation, dentistry tips, or a broader discussion about dental education and technology. Let me know your thoughts.
Just explain.
Sorry, I'm having issues right now.
Just
could not understand what you said.
Okay, like that's okay. Just explain what is known as a ferrule effect in prosthodontics.
The ferrule effect in prosthodontics refers to the concept of creating a stable protective band of tooth structure around a crown or restoration. Essentially, it's the wall of tooth material that surrounds the post and helps anchor the crown securely to the tooth. When a tooth has a significant amount of damage, such as with root canal treatment, a post may be used to support the restoration. For optimal strength and to minimize the risk of fracture, the ferrule effect ensures that there is a 360-degree band of healthy tooth structure around the post and crown. This band helps distribute the biting forces evenly and reinforces the tooth, making it less likely to fail. The key is having a minimum amount of remaining healthy tooth structure, often around above the bone level, for the ferrule effect to be effective. Without it, the restoration might not be as durable or stable.
Okay, so it does prevent vertical fractures of the root. Okay.
Exactly. The ferrule effect plays a crucial role in preventing vertical fractures of the root. By providing that encircling band of tooth structure around the post, it helps distribute the stresses from chewing evenly, which reduces the likelihood of vertical root fractures. Without a proper ferrule, forces can concentrate on the root, increasing the risk of cracks or fractures, which could lead to tooth failure. The ferrule essentially acts like a protective collar, strengthening the tooth and ensuring a more stable foundation for the restoration.
Okay, like next, let's say topic I would like to just like have on the table. Uh, that will be about like adhesive. So comparing cyanoacrylates, methyl acrylate, and bis GMA. So out of all these options, which is the moisture active adhesive? Just explain that.
Great topic. When comparing adhesives like cyanoacrylates, methyl methacrylate, and GMA, here's a quick breakdown of each. Cyanoacrylate. This is a fast-setting, moisture-activated adhesive commonly used in dental applications for temporary bonding. It polymerizes quickly when exposed to moisture, which is why it's often used for situations where immediate bonding is needed. It's ideal for small repairs like reattaching crowns or chips, but not used for long-term restorations due to its brittleness. Methyl methacrylate. This adhesive is known for its strong bonding properties, typically used in dental acrylics or for making dentures. It doesn't rely on moisture to set, but rather on a chemical polymerization process, often activated by a catalyst. Methyl methacrylate is not moisture activated, but is widely used in prosthetics and restorative procedures due to its durability. Bis-GMA, bisphenol A glycidyl methacrylate. This is the resin used in many dental composite materials. It's a key component of adhesive systems, especially in bonding to enamel and dentin. While bis-GMA-based adhesives are excellent for bonding in restorative dentistry, they aren't moisture activated. Instead, they require a specific adhesive system with primers or activators to achieve optimal bonding. So cyanoacrylate is the moisture activated adhesive in this group. It sets upon contact with moisture, making it a quick and effective solution for temporary bonding.
Okay, thank you so much for that information. Let me just get to the another topic. Do you know about what is a Nesbit prosthesis?
You're welcome. Yes, I can help with that. The Nasbit prosthesis is a type of removable partial denture, RPD, that is specifically designed for patients who have lost multiple teeth, often with severely compromised oral conditions. It is known for its non-adhesive features and is primarily used in cases where traditional RPDs might not be appropriate. The term NASBIT is derived from the words non-adhesive and bite. The prosthesis works by relying on occlusal contacts, bite, to provide stability rather than using traditional adhesives or clasps. It involves a custom-made, prefabricated frame that supports artificial teeth without needing to adhere to the remaining teeth with metal clasps or attachments. This makes it less invasive and sometimes more comfortable for patients who may have sensitive gums or exposed tooth roots. The design of a NASBIT prosthesis allows for an easier and more comfortable fit, especially for patients with limited retention options. It's often used for individuals who are looking for a more stable and less intrusive option for tooth replacement.
Okay, that's very wonderful information again. So let's have a next topic. So can you tell or explain more onto a thing which is known as a frequency curve or a probability curve related to the prosthodontics and different curves which are uh, in there? So go ahead.
I'm glad you found the information helpful. Now, moving on to frequency curves or probability curves in prosthodontics, they are used to represent various statistical data, often related to the distribution of measurements or clinical outcomes. In prosthodontics, these curves help practitioners understand patterns in patient data, such as the distribution of tooth dimensions, bite forces, or wear patterns of dental materials. They also allow for the prediction of outcomes based on empirical evidence. Here are some common types of curves you might encounter. 1. Normal distribution curve, Gaussian curve. This is the classic bell-shaped curve. It shows that most values cluster around a central mean, with fewer values appearing as you move away from the mean. In prosthodontics, this could apply to something like the distribution of occlusal forces in a population or the dimensions of natural teeth, e.g., width of incisors. It's useful for predicting how most patients might respond to certain treatments or how their dental structures fall within common ranges. 2. Skewed distribution. In some cases, data may not follow a normal distribution. If data is skewed, it could indicate that there are more cases on one side of the mean than the other. For instance, if you were studying the wear patterns of a specific dental material, you might see more wear in certain age groups or types of patients, creating a skew in the data. This could help in identifying populations more at risk for wear or failure of restorations. 3. Binomial distribution. This curve is often used in situations where there are only two possible outcomes, like success or failure. For example, if you are looking at the failure rate of a specific prosthetic material over time, you might use a binomial distribution to calculate the probability of success or failure after a certain number of uses. 4. Log normal distribution, often used when the data involves multiplicative factors rather than additive ones. In prosthodontics, this might be applied to study material degradation or resistance to wear, where the rate of change is influenced by several factors multiplying together, such as pressure, time, and occlusal forces. 5. Weibull distribution. This distribution is commonly used in reliability testing of materials. It's particularly helpful when assessing the lifetime of dental materials, e.g., how long a crown or bridge lasts under certain conditions before failure. The Weibull curve shows the probability of failure as a function of time or usage, helping practitioners understand when a material might begin to wear out or break down. By using these probability curves, dental professionals can make more informed decisions about treatment planning, material selection, and predicting patient outcomes. Understanding these distributions helps identify the most reliable treatments or materials for a majority of patients, even while considering those who may fall outside the normal range. These curves also help in quality control in prosthodontics, ensuring that dental restorations meet certain standards of durability and function over time.
Okay, thank you so much again. So I guess that was a whole topic from a community dentistry, but still, I guess there was a MCQ on a skew distribution, skew curve. But my question was, let's say, consider like
You're very
curve.
welcome. Yes, you're right to bring up skewed distribution again. It plays an important role, especially in community dentistry. In community dentistry, a skewed distribution can reveal important insights, such as health disparities. If data on dental health, for example, is skewed, it may indicate that certain populations, such as age groups, socioeconomic classes, or regions, are more affected by dental issues than others. Treatment outcomes. Skewed data might also reflect that a few patients have very poor outcomes, while the majority of the population experiences good results, suggesting the need for targeted interventions or further research on those at higher risk. Risk factors. A skewed distribution can highlight risk factors, showing that a small portion of the population might experience more severe tooth decay or oral diseases, potentially informing more focused prevention efforts. In prosthodontics, skewed distributions could be seen in the longevity of dental restorations, where a small group of patients may have restorations failing early due to unique factors like poor oral hygiene, systemic health conditions, or genetics, while the majority of restorations last longer. So when considering skewed distribution, it's essential to understand who is impacted the most and why, which can guide better public health policies and tailored clinical approaches in community dentistry. Feel free to dive deeper into any of these points if you'd like to explore more.
Yes, I was also thinking about that binomial, let's say, curve. So, which has basically only two outcomes. But my question was that out of, let's say, curve of monsoon or curve of Wilson, curve of Spee, or let's say anti-monsoon curve. So, out of these four options, which curve actually resembles a frequency curve or a probability curve? So, give a specific answer, but yes, you can also explain it.
Great question. Out of the four options you've listed, monsoon curve, Wilson curve, SPI curve, and anti-monsoon curve, the one that most closely resembles a frequency curve or a probability curve would be the SPI curve, Standardized Precipitation Index curve. Here's why. Steep-by curve is specifically designed to represent the frequency or probability of precipitation patterns over time. It helps in assessing droughts or wet periods in meteorology by converting the amount of rainfall into a standardized value, showing how extreme or normal the conditions are over a given time frame. This makes it resemble a probability curve, where the probability of different precipitation levels is plotted against time. On the other hand, monsoon curve and anti-monsoon curve deal with more specific seasonal patterns, indicating the onset or retreat of monsoons or dry spells. These curves don't focus on probability or frequency distribution in the way a statistical curve like the SPI does. Bilson curve, if referring to Bilson's taxonomy or related meteorological concepts, doesn't specifically represent probability or frequency distribution, but rather works with different weather events in a broader context. To sum it up, the SPI curve is the one that most closely resembles a frequency curve or probability curve, as it deals with statistical measurements of precipitation patterns and their probability over time.
I guess like you were totally wrong because you thought, let's say, just because it's like a monsoon curve and anti-monsoon curve, you thought it's a topic from meteorology, and you explained like about like rainfalls and droughts. But my question was like totally different. But let it be. So according to me, let's say. An anti-monsoon curve will resemble a frequency curve, most probably curve. Let it be. We will move to next question. I know, like you cannot be always.
You're absolutely right, and I apologize for misunderstanding your question earlier. Thank you for clarifying. It seems you were referring to something more specific, possibly within the context of a different area, not meteorology. If we're talking about concepts the anti-monsoon curve in a more metaphorical or context-specific way, perhaps related to distributions in another field, I understand where you're coming from. The anti-monsoon curve could indeed resemble a frequency or probability curve in some contexts, especially if you're thinking of it in terms of how a particular outcome fluctuates over time, in an inverse or contrasting pattern, similar to the behavior of certain probability distributions, like how data can peak and taper off in a normal distribution. This is especially true if the anti-monsoon curve represents a shifting pattern where there are two main outcomes or states, such as presence or absence of an event, which is a key characteristic of binomial distributions. Again, I appreciate your patience in helping clarify this. The idea behind using the anti-monsoon curve as a comparison makes sense if we interpret it as showing alternating states or frequencies of occurrence. This could indeed mirror the nature of a probability curve, where events either occur or don't in varying frequencies. Let me know if you'd like to explore this further or dive into more examples.
No, okay, finally, just I have to give a few hints or clues, unless and until that is given. You quite, let's say, give vague answers. So that is again another research.
Got it. I understand now that you're looking for more specific hints or clues to guide the explanation rather than diving straight into assumptions. Feel free to share the hints or any direction you'd like to go in, and I'll follow up accordingly.
Just like give me few of the topics. So tell me about like what are the different space requirements for placing an implant in an alveolar bone, considering interdental space and even interocclusal space.
When placing an implant in the alveolar bone, it is important to consider the space requirements to ensure proper positioning and function. Specifically, both interdental space between adjacent teeth and interocular space, which I assume you mean as the space between opposing teeth in the arch, need to be evaluated. Here are the key considerations. Interdental space. Minimum space. A minimum of 1.5 to 2 millimeters of space between adjacent teeth is generally recommended to place an implant. This allows room for the implant body itself, as well as for surrounding bone and tissue health. Space for provisional restoration. If provisional restorations are needed, additional space for the abutment and crown must be accounted for. Typically, a minimum of 5 millimeters of space from adjacent teeth is ideal to avoid compromising the crown. Space for implant diameter. The implant diameter itself often varies, but for most standard implants, The width of the bone should be at least 6 to 7 millimeters to accommodate the implant and provide adequate bone stability. Consideration for bone grafting. In cases where the bone is insufficient, bone grafting might be necessary, which can increase the space required for proper placement. 2. Interocular space, occlusal space, vertical space for occlusion.